Okay, so this is your last module for Pharm 1. I'm sure there's a big sigh of relief there. We're going to cover the pharmacology in Module 8 for Exemplar 8A, it's HIV and AIDS, and Exemplar 8B, which is only one drug, for hypersensitivity. So HIV and AIDS, those drugs, you have a chart in your Pearson text on 498 and 499. It's antiretroviral therapy, or ART, which some of this should be covered a little more in community also. So risk of mother-to-child transmission is 25% without it and 1 to 2% with antiretroviral therapy. The lab tests look at your CD4 and T cell counts, your viral loads, resistant testing, and fewer than 1/3 of HIV are on ART, or antiretroviral therapy, which is sad. CDC guidelines, all, regardless of their CD4 count, should be on ART to reduce HIV morbidity and mortality and prevent HIV transmission. That is the goal. That is not what is happening. Drug selection. So you have your nucleoside and nucleoside reverse transcriptase inhibitors, NRTI. Nucleoside reverse transcriptase inhibitors. Say that 3 times fast. Okay, and one active antiretroviral drug, or ARV. If they're also positive for TB, they're going to add the TB therapy of rifampin in there, possibly isoniazid. They need a 95% medication compliance to be effective. A combination is often done to stop viral duplication. When they pick them, related to genotype resistance if available. Lots of viruses have that way with genotypes, even with the COVID going on now, which is a virus, they are finding genotype resistance to treatments, and how that virus affects the body. Comorbidity, liver or renal dysfunction, and depression. They're looking for these when they pick their drugs: potential drug-drug interactions, pregnancy status, and willingness to initiate treatment. So your nucleoside reverse transcriptase inhibitors, or NRTIs, also known as nukes. That's an easier way than saying that whole word every time. Take without regard to food, inhibits the viral replication, which is the goal. Dose adjustment with renal dysfunction, so there's some caution there. Change body metabolism due to mitochondrial activity. Common side effects: transient nausea, diarrhea, abdominal pain, hypersensitivity, and rash. Understand when you're teaching that these drugs do not cure or kill the virus, they just decrease the replication. And disregard this, would take without regard to food. That's what I have found in the drug handbook, but in looking in here, the zidovudine and the didancine, or the first one, zidovudine, take about a half hour or 1 hour after meals if tolerated, but the didancine needs to be taken on an empty stomach. The didancine also needs to be taken with an antacid, or the stomach acids will destroy the drug. Let's see what else I have here. Peripheral pancreatitis. Pancreatitis is the biggie. The zidovudine, let's see, stick to that. Swallow the capsule whole. Watch for blood dyscrasias with their CBC. Any of these, you're watching for sore throat, swollen lymph nodes, fatigue, and weakness. Immediately to report intractable nausea, muscle pain. It has lots of drug interactions, so before taking anything else, always report which you're going to go on. This zidoduvine is the first and still used for prophylaxis. The lipoatrophy that can happen is a wasting of the fat on the extremities, face, and buttocks. It can happen with chronic use. It's redistributed to the trunk. You'll see that often, like in an alcoholic too, this lipoatrophy. So let's go on to your. These are some of your others. Tenofovir, which your text doesn't list. Your text just lists the didanosine for patients that are intolerant or resistant. That's the only time it is used. I don't even have it listed here. But pancreatitis is a big risk in the muscle wasting, muscle pain, anything else. That's really all I need you to know on this one. Pancreatitis. Okay. Let's go on. Your non-nucleotide reverse transcriptase inhibitors, or NNRIs, or non-nukes, directly bind to the reverse transcriptase enzyme and block lower pill burden. That don't have to take as many pills, but there are many resistant strains to this. Only use one at a time. They cannot be used in combination. Take on an empty stomach. It's the only HIV drug that actually penetrates the central spinal fluid. Caution in pregnancy, neurological symptoms, nightmares, sedation, euphoria, because it goes into the cerebral spinal fluid. Watch for Stevens-Johnson syndrome and hepatic failure. So back here, remember the zidoduvine is the first line. Okay, protease inhibitors. Text this doesn't go into, unless I'm missing it in here. I don't see them listed here. So your protease inhibitors, used in combination with your nukes, act at the end of the HIV life cycle, bond chemically with protease, block viral assembly. Viral resistance occurs quickly, high protein bound, and metabolized by the liver. An example is ritonavir, results in immature, non-infectious viral particles. So it just breaks that thing apart. Prevention treatment of opportunistic infections and malignancies. All patients with HIV need the pneumococcal influenza, Hep B, and Hib vaccines. Hib vaccines usually only given in children, except for when they're HIV patients with positive TB test, negative chest x-ray, get prophylactics with their isoniazid. If they have low CD4 count, looking for pneumocystic pneumonia. Going. Combination therapies are combines 3 or 4 antiviral drugs, reduce incidence of drug resistance by doing this combination. More likely to decrease viral load and symptoms, does not eradicate the infection. Schedule affects daily life because you're taking so many pills. Complicated schedule, expensive, and adverse effects can be fatal, especially that pancreatitis and significant blood dyscrasias. Compliance is the hugest issue, and you need to work with them with scheduling. Usually it's like the health department has specific nurses that just do this in the home and in the health department itself. Pre-exposure prophylaxis, or PrEP, a way for people who do not have HIV but who are at substantial risk of getting it by taking a pill every day. This is shown to be very effective. Truvada contains tenofovir and emtricitabine, 2 of the different antivirals. It keeps the virus from establishing a permanent infection because it breaks it up. Can reduce the risk by 92% if taken daily. Healthcare provider assessment with labs every 3 months. It's a powerful HIV prevention tool. Can be combined with condoms and other prevention methods for even greater protection. People who use PrEP must commit to taking the drug every day and seeing their healthcare provider for follow-up every 3 months. Here's just another picture. Should be initiated within 72 hours of the event. Continued for 4 weeks. Most common adverse events are nausea, malaise, and fatigue. This can be used when they're in a permanent relationship with somebody with HIV, and sometimes as a preventive after a rape. Complementary and alternative therapies are garlic with their HIV meds, St. John's wort with antiviral therapy to decrease the side effects of some medical treatments, increase comfort related to acute exacerbations, and consult the physician before starting any kind of CAMs. Hypersensitivity pharmacology, this is easy. Anaphylaxis is an allergic reaction that affects the airway, breathing, and consciousness, ABCs. Mild or moderate is just your itching, swelling, nausea, vomiting, and cramping, but it's still an allergic reaction. Highest priority for the patient with acute anaphylactic reaction is looking for severe laryngospasms. They might need an emergency tracheostomy or endotracheal tube, ET tube intubation, getting IV line, fluid resuscitation with hypotonics such as normal saline. Anaphylaxis is risk for vasomotor collapse and hypotension. Here's a picture anaphylaxis. Treat with epinephrine. It's an alpha and beta adrenergic, that's sympathetic nervous system, IM or sub-Q. Relaxes smooth muscle of bronchial tree, mydriasis, tachycardia are possible complications. Remember, mydriasis is the pupil dilation, and tachycardia and relaxed smooth muscle because it's your fight or flight, relaxing the alpha and the beta, so adrenergic. So all through the body, all the smooth muscle is relaxed. And I did show you the EpiPen in a previous. They have a junior dose and a adult dose. Antihistamines. You have your diphenhydramine, cetirizine, and loratadine. You notice the ine ending of antihistamines. They are anticholinergics. They block that sympathetic system. I can't see, can't eat, can't pee. So decreased secretions and dry mouth is the most major side effect. CNS depressants. Caution if they're on a CNS depressant because they're slowing everything down. Don't operate machinery. The very young, the very old are more sensitive to it, and use caution if you're lactating, breastfeeding, because it goes through the milk. Leukotriene modifiers, I mentioned this a little bit on your previously on your pulmonology drugs. It wasn't on a slide, but I mentioned it. Leukotriene modifiers, which the only one is your monticulus or Singulair. Prevents the leukotrienes from attaching to receptors in the immune cells of the lungs. It is not for an acute attack. Takes about at least a week for improvement. It is a preventive measure. Indications, prophylactics and long-term treatment of asthma and allergic rhinitis. Caution if they're allergy to providine or lactose. Adverse effects can be headache, nausea, diarrhea. And then the last is your corticosteroids. Most commonly, you have your methylprednisolone or your Medrol. It is the only one I'm going to cover here. You will have more when we get into arthritis. I think it's in Pharm 2. We'll cover more of your corticosteroids. Caution in renal impairment, glaucoma, peptic ulcers, diabetics, systemic infections. Corticosteroids, if you're non-steroidals, block the prostaglandins. That's exactly how your corticosteroids, which are steroidals, block the prostaglandins. So increase your glucose, excreted in the kidney, so you're watching for that peptic ulcer because it's blocking the prostaglandins. Last thing, plasmapheresis, that is used when they have to remove certain antibodies from the plasma. So they filter the blood. All the blood goes back in. They're just filtering the blood from the plasma. Blood is passed through the blood cell separator. Plasma and glomerular damaging antibodies or antigens are removed. Blood cells are returned with the albumin and plasma, done as a series of treatments. It's very risky, but it is done in significant situations where people have this hypersensitivity to a lot of things. And that is the end of your last recording for Pharm 1.